This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Did you know that 1 in 5 Americans will develop skin cancer by the age of 70? Here to tell us how to beat the odds, we welcome Providence Medical Group dermatologist Dr. Joe Martin. Good to see you.
Hi, thank you for having me.
Absolutely. So it's fascinating, though, that in the Northwest we have such a high rate of skin cancer. Why do you think that is?
There's a couple reasons. I mean, first and foremost, there's a lot of people who are very fair from Northern European descent.
And that's why we hang out in the Northwest.
Exactly.
I got it.
Exactly. And then I think we also get in the habit of not wearing sunscreen regularly. So when the sun finally comes out, like on a beautiful day like today, everybody goes outside, we forget to put our sunscreen on, we all get fried.
We all get burned.
And then we all get
Is there such a thing as a healthy tan?
No. By definition, to have a tan, you have had some damage to your DNA.
Okay.
And so to get a tan, that means that there has been some damage. So I try to end each summer exactly the same color that I started.
Interesting. And any person of any race can get skin cancer, right?
Absolutely. I mean, the more fair you are, the higher the risk. We have a little bit less protection when you've got less melanin, but or pigment. But yes, absolutely. Anybody can get skin cancer.
All right, let's take a look at some pictures, and I want you to describe what we're seeing and what we need to look out for. So start with this.
So this is talking about the Abcdes of melanoma, which is supposed to be a way of kind of describing what to look for when you're looking at a mole in terms of what to be worried about. So A stands for asymmetry, and clearly you can see that this is an asymmetric mole.
Right.
B is border, so you can see here that the border is jagged, it's irregular, it's not smooth.
That kind of looks like Jackie's mole that we saw earlier, right?
Exactly.
Okay.
Exactly.
Okay.
C is color, so you can see there's a lot of variability with the color. I mean, your moles should be pretty uniform in color, so if you're seeing black or red or gray or other colors showing up, that's a worrisome sign.
And diameter.
Diameter. So diameter is meaning that if your mole is bigger than a pencil eraser, sometimes that can be concerning. If you've had the mole since you were a child, it is a little bit less of an issue, but that is something to pay attention to as well.
And then that it evolves.
Yeah, and for me, that's actually the most important sign. So Jackie was talking about how her mole was changing.
Right.
And typically, once you get a mole, it should be relatively stable.
Right, it shouldn't change.
It shouldn't change. And so if you notice that a mole is changing, it's getting bigger, darker, different colors are showing up, the border is changing, that's something that definitely needs to be checked.
I was surprised to hear that it happened during her pregnancy, and you've noticed that too.
Yeah. I mean, we think that probably it's estrogen that can help drive changes in moles, and it definitely happens that people get more moles during pregnancy, and they absolutely can change as well.
What are your suggestions on protecting ourselves?
So it's sort of multifold. I mean, I think sunscreen is important, and a lot of attention is paid to sunscreen, but I also think that staying out of the sun, staying out of direct UV light, wearing hats, protective clothing are kind of undervalued, and they're really easy ways of making sure that you're not getting quite as much UV exposure.
Okay, you have some sunscreen here. Is this something that you really like, or what is the point here?
So there's a couple things to look for when you're buying sunscreen. So the first one is to make sure that you have an SPF that is at least 30 or higher. If you're really fair, aiming for something that's 50 or higher is actually a good thing to do. You also want to make sure that it is broad spectrum. So you can see here that it's broad spectrum. This means it covers UVA and UVB, which both can cause not only skin cancer, but then also sun damage, which are lines, wrinkles, dark spots, things like that.
I mean, the sun is what ages us the most, right?
Okay. Exactly. And there's huge differences in terms of how well people age depending on how well they protect their skin. And then this one here, this is a little stick sunscreen. It also has zinc as the main ingredient, and zinc and titanium are really nice sunscreen ingredients. They tend to go on a little bit more chalky.
Thicker, yeah. You can really see that.
You can, which is unfortunate, but they are really good sunscreens, and
so
especially
if you really
for
want
kids.
to protect yourself.
Yeah.
And I'm not sure what the shot glass is for, except to maybe drown your sorrows, but you tell me.
So this is kind of an illustration of how much you're supposed to use.
Oh.
Okay. So the main issue with sunscreen, main problems or I think mistakes that people make, there's twofold. One is not using enough. So to cover your entire body, you need 2 ounces, which is a shot glass. This is a lot of sunscreen.
Right.
And then the second thing that we all forget to do is reapply. And so really every 2 hours, if you're out in the sun, you should be reapplying. And then if you're going to be in and out of water, if you're swimming in the pool or you're going rafting or anything like that, then you should be reapplying every single time you get back out of the water.
And one of the things you mentioned, clothing. They make some great sun protective clothing, right? And the hats. And
Absolutely.
you should check your scalp. You should check all areas, or have someone do that for you.
Absolutely. You can always ask your hairdresser if
Right.
you know, because it's tough to see your scalp. If you've got someone who can check your back, it's a great thing to do. If you're not sure, just come in. You know, I mean, we do skin checks all the time. We're always happy to do it. And there's oftentimes things that we find that people didn't even know were there.
Wow, interesting. I want to tell folks if they'd like to find out more about preventing skin cancer, just head to KATU.com, click on the Features tab, and then Family Matters, and there you will find helpful links and important guidelines. Thank you so much, Doctor.
Thank you
Appreciate
so
it.
much.